What I do most outside the office is spend time with my family, right? I have two children. My older one is named Ryan, he's 8, and my younger one is Luke, he's 5. And you know, when I come home every night, they're there, and they're awake, and they're excited to see me. When I leave in the morning, sometimes they're awake, sometimes they're not. It depends on how early I leave or how early they wake up. So really that's where my passion is. I love spending time with my wife, Jordan. You know, a lot of times on the weekends we'll come out and play basketball, or if I'm home early from work. Oh, it's so great. They just make me laugh and smile all the time. When I do care for children that are around my kids' age and somehow remind me of my kids, it does get a little, sometimes it can get emotionally challenging. But for the most part, I'm able to separate it just because I think it historically was separated from me as a person. Otolaryngology for me had the right combination of office-based as well as operative-based cases. It also had the anatomy that I was really interested in. I really enjoyed working in the anatomy of the head and neck. You know, there's a lot going on in the real estate between the neck and the skull. You know, there's a lot of blood vessels that go through there, there's a lot of nerves that go through there, and a lot of functionality happens as well. And working on that anatomy in that tight of space is very interesting and challenging. Plus the function. Most of the communications go through the field of otolaryngology. So hearing, speech, vocalization, and smell as well, because I think it's very interesting to be able to rehabilitate some of those senses. I realized that what was most exciting to me was being able to impact a child, because that impact lasts for hopefully 100 years in the future. I remember in medical school a general surgery resident telling me the first time he cut skin, his hand was shaking and he was terrified. And I thought about that the first time I cut skin, and I was a little bit terrified. It's like, so it's this violation, right? I mean, we're doing something that's really antithetical to everything as human beings we're supposed to do. We're causing an intentional injury in order to obviously repair something. But this is something that's scary, invasive to the nth degree, but it's a privilege to be able to do it. I performed the pediatric airway reconstruction on when he was like 18 months old, I think. And he still comes to the office once every 6 months or so. And every time he comes in, he gives me a big hug. And I don't know, I mean, I kind of know why, but like, I don't know that he really understands what's going on. I have the privilege of having a number of children for whom I follow for many years because of ear problems or airway problems. And it's really a pleasure to watch them grow and develop into little people and then sometimes bigger people. The other case that I can recall involved, I think, an 11-year-old girl who had a complex airway tumor. And the complex airway tumor was in a location right at the voice box level. And that airway tumor was causing severe impingement on the voice box. So we brought the child to the operating room. We took a biopsy and debulked, took out some of the tumor to find out what it was. This tumor was benign. This wasn't even cancerous. So we said, well, we need to remove the tumor, but the tumor is very large and in a very tricky spot with multiple nerves running around it. And that was a case where we had to combine several different aspects of airway surgery that we do into one complex case. So today's procedure was, I thought went really well actually. The problem that she had was that the vocal cords were scarred together and that caused narrowing of the airway. And what we did in today's case is we took a piece of cartilage from the rib with the help of the pediatric surgeons, and we used that piece of cartilage to expand the airway by separating the vocal cords apart. And when we do that, the airway is open wider. And so this child will stay intubated for a week, and that allows the cartilage to heal in place. And then after a week, we'll plan to take the endotracheal tube out, and hopefully the child will be able to breathe much, much better. We're doing a large number of these types of airway reconstructions at this point, and the team we have is the team we almost always have for all these reconstructions. So it really runs very smoothly at this point. The nurses are very attuned to what we need and how we have the operating room prepared, and these cases are complicated. There's a lot of moving parts, there's multiple services involved, but luckily with the experience that we have at Cohen Children's Medical Center, we're able to put all those pieces together and have really a smooth surgery with limited risk. And these are complicated surgeries, and to be able to do that on a regular basis is pretty great. And it's great to be part of such an amazing team. Sometimes parents will ask me in the office, what would you do if this was your kid? And I used to say, well, I don't answer that question and dance around it. And more I've realized that I really should be answering that question. And that happened really when one of my kids needed a frenulectomy. They needed a tongue tie release, and it's a relatively simple procedure. And I thought about the way it would be done and who would be doing it and how it would be done. And I said, well, gee, if I'm going to do it this way for my kid, then maybe I need to be doing it this way for all kids. And then I said, well, maybe we need to be answering that question, because I don't know that it's fair to families not to give that answer. So now I'm actually quite candid about it. Well, if this was my child, I would recommend this, or if this was my child, I would recommend that. It's an interesting thing having a family entrust their child's health to you. Sometimes their child's life, but usually it's their health. Usually it's about making people feel better. I think it's an awesome responsibility, quite frankly, and I feel humbled by it on a daily basis.